Hi, everyone. Welcome to night 2 of Brain Awareness Week with the Society for Black Neuropsychology. I'm Dede O'Shea, chair of the SBN Education Committee. We had a wonderful start to our brain health series last night with Dr. Ray talking about prenatal health, and you can find that video on our YouTube channel. I'm so excited to welcome tonight's speaker, Dr. Yinka Reed, who'll be speaking about brain health in older adults. And we'll be taking questions throughout the presentation in the chat box. All right, here is Dr. Reed.
Hello. All right, I just want to go through setting up my screen share here. Oh, very good. Okay. Good evening or good afternoon, good morning, wherever you may be right now. So just a shameless plug for the upcoming talks that we have with Dr. Grant and Dr. Butt on midlife brain health and then brain health in kids the following evening. But I am going to be speaking about brain health in older adults. So for Brain Awareness Week, let me go back. I suppose I should sort of do a little bit more of an introduction. I am a clinical neuropsychologist at Rowan Virtue School of Osteopathic Medicine. So I solely work with older adults. I'm housed within the Department of Geriatrics and Gerontology. So you have to be 55 years just to walk into the door. So this is what I love, and this is what I'm doing in my day-to-day. So I think that a really good place to begin is thinking about what is normal aging versus dementia. I often am speaking with families, patients, caregivers about what they should be concerned about and what are the sort of normal changes in thinking that everyone will experience as we get older. The structural integrity of our brains changes as we get older. Everyone's brain shrinks a bit. So the structural integrity changes, so our thinking changes. But there are some changes that are concerning. So just some data pulled from the CDC, Alzheimer's disease and related dementias are not an inevitable part of aging. Up to 40% of dementia cases may be prevented or delayed. Normal brain aging may mean slower processing speeds and more trouble multitasking, but other aspects of thinking are stable and may even improve with age. So not everyone, just as we get older, is going to become much more forgetful. Like we can have some sort of lapses in memory, but to be completely forgetting information is not something that we would expect to see with normal aging. That slower processing speed, that means your brain is working as it should, but it's just working a bit slower. So it may take you longer to retrieve that information. It may take you longer to think of this person's name, someone who maybe you don't see very frequently. You see them at, family reunion sort of thing. It may take longer to retrieve the information, but not that you completely would not be able to access that information. It's normal to occasionally forget recent events, such as where you put your keys, the name of someone you recently met. Oftentimes, probably one of the biggest complaints that people may have that can certainly be a part of normal aging is I walk into a room and I forget what it was that I was going to retrieve. And so we all have these lapses. We all have moments when we can't think of the word, it's past me the whatchamacallit, or again, you walk into a room, forget what you were looking for, you're misplacing items. And especially depending on what's happening in your life, how many stressors you may have, those things may happen more frequently. But really, we recommend that you follow up with someone or just have some sort of, have someone evaluate whether or not these things are normal when you're unable to complete routine tasks without help. If you have been using a certain appliance, household object for a while, or you've been managing bills for a while, and now you're having difficulty with keeping track of payments and that sort of thing, that's not something that we would necessarily expect with normal aging. If you have difficulty naming items or close family members or friends, forgetting the function of items, certainly if you look at something, a pen, and or someone, a family member has no idea what I'm meant to do with this. Do I eat this? Do I write with this? Not knowing what the function of it is, that certainly is an indicator that something more is going on. Repeating questions, taking much longer to complete familiar tasks. So even if it's like, I am able to manage the bills, I'm not missing payments, but it used to take you half an hour and now it's taking 3 hours, then that's concerning. That slowed processing speed, which is a normal part of aging, maybe you go from half an hour and progressively over time, it starts taking you maybe 45 minutes. That's not something that I'd necessarily be alarmed about. But if it becomes much more laborious to do things that you know how to do or that a family member knows how to do, then it's worth following up with your primary care provider. Being unable to retrace steps and getting lost in familiar areas or familiar driving routes. So going to places that you frequently go to, grocery store, post office, friends' homes, church, etc. So there are changes, all this to say that there are changes in thinking that happen with aging. It will happen to everyone. Not everyone has to develop dementia. That's not just something that happens to everyone. And then, they have a apparent memory problem. That's not a normal part of aging. And so I think that trying to discern or really keeping in mind that there are changes, but they should not be significantly impacting your daily functioning, particularly those aspects of your daily functioning that are routine that you have been doing. Excuse me. So thinking about aging in older adults, what are the main, I'm going to go through several sort of main recommendations that are specifically for older adults, of course. The first being to optimize management of chronic conditions. So, and I had my notes here. I'm just chatting on. So optimize management of chronic conditions. What are chronic conditions? High blood pressure. I have several very common conditions listed here. There are many others. High blood pressure, high cholesterol, and I include here the medical terminology here. So hypertension is something, if you ever have discharge papers or you see aspects of your medical record, which you have a right to, hypertension, high cholesterol, hyperlipidemia. Sometimes you'll see it listed as dyslipidemia. That's not strictly high cholesterol, but I see them interchangeably used within the medical record indicating high cholesterol. That's why I include it here. Ischemic heart disease, arthritis, diabetes, heart failure, chronic kidney disease, COPD. These are chronic conditions. I think what's important to note here is that Black folks, especially in the United States, there's a higher prevalence of many chronic conditions, several chronic conditions that are listed here. The way that I like to think about it is if it affects the heart, then it affects the brain. And we tend to have high blood pressure run in the family, high cholesterol run in the family. There's a number of psychosocial systemic reasons for that. But we have a lot of chronic conditions, essentially. We are susceptible to vascular comorbidities. And so we want to make sure that we're staying on top of those things. Why it's important to manage these chronic conditions. They're distressing, they're uncomfortable, certainly. They'll interfere with social and physical activity and general health behaviors, which are also an important part of brain health in older adults. I'll speak to that a bit later. If they're not managed properly, then they can progress and turn into something much larger, much more serious, require hospitalization, sort of a snowball effect. You have high blood pressure, you've not been really managing it consistently or optimally, and then that leads to potentially a stroke, right? And then being in the hospital and rehab and the cost and just all the burden that comes with that. Not to mention, of course, the effect that it's going to have on your thinking, your brain health. So these things can snowball if you don't sort of stay on top of them. They can cause these new conditions. They can create disability within older folks. When medication or when chronic conditions are not adequately managed, then sometimes that can prompt additional medications being added. And then we get into the difficulties that come with managing lots of medications. And so if something does not have to progress to the point of needing additional medication, additional intervention, then we don't want to have to do that. So sort of spoke on creating health crises and emergencies. All right, so what can we do, or what should older adults be doing? Maintain your own up-to-date list of chronic conditions. You may see providers in different hospitals or different locations. Many health systems can share information, but not always. And so I love when my patients and families come in with a little folder, with a binder that has up-to-date medications, that has sort of major medical events, tracking these things. And if you're not sure what your chronic conditions are, that is you have a right to your health information, and ask for it. Ask for the notes from, your most recent visits from your primary care provider. Maintain copies of lab results and radiology results. So any sort of workup that you might have. Develop chronic condition self-management skills. So really, that's referring to things like if you have diabetes, then knowing how to monitor your blood sugar, knowing what your sort of optimal levels are, knowing what your last A1C was, knowing what the proper diet is, a diabetes diet, essentially. Learn to research best practices for managing a chronic condition in older adults. Now, certainly I'm not proposing that folks develop some sort of expertise in every and any chronic condition that they may have, and especially if there are family members or caregivers who are a bit more, how did my patient refer to it as a digital native, Googling these things, managing hypertension in older adults, older Black adults, just thinking about even the way that hypertension is managed in Black folks in this country versus white folks in this country. There's a difference. But you can sort of Google these things. What are the things that you need to be looking out for? What are the recommended best practices? Because best practice guidelines are given by a number of organizations, sort of geriatric related organizations, older adult, like health and older adult organizations. And it's not always that providers are complying with the recommendations, with the latest recommendations. They may not be aware of it. So this is certainly not to villainize anyone, but essentially being an advocate for yourself. Bring a relative or other trusted person to your health visits. If it feels like overwhelming, if you feel like those visits if information is being given too quickly, or for whatever reason, it's always helpful to have another set of ears and eyes in the room. Then bringing someone to the visit. It doesn't have to be just because of such severe impairment that you require a caregiver to be with you. It can just be for support, so that they're able to ask questions that you just don't think of, and essentially advocate for you. And then keep track of what requires follow-up. Be proactive. So when you leave the primary care office and they say, get this lab, this ultrasound, and whatever, a third, some sort of, let's say, an MRI, then following up with those things. I have seen, especially with my Black patients, it's happened on more than one occasion where they sort of fell between the cracks, so to speak. Offices aren't necessarily going to reach out and say, did you do this thing? And so trying to make sure that you are complying with that you understand whatever the recommendation may be and that you're complying with it. All right. Medications. So older adults are at increased risk for harm from medication side effects or interactions. Now, all medications have side effects. Even your over-the-counter medications, they have side effects. The way that older adults metabolize medications and substances, which we'll speak to later, it's different. It's not a bad thing. It's not a good thing. It's just a fact, right? It doesn't matter how healthy you are. Our bodies work differently on a metabolic level as we get older. So keeping that in mind, we want to avoid polypharmacy. That's just the medical term used for simultaneous use of multiple drugs by a single person for one or more conditions. So it's not uncommon for folks to be taking 2 medications for hypertension. I've seen folks take several medications for a headache. We want to ensure that you have adequate symptom management. We want to make sure that the high blood pressure, high cholesterol, whatever it may be, is adequately managed with the least amount of medications possible. And so given the susceptibility to medication side effects and interactions, avoid anticholinergic medications. These are medications that we know negatively affect memory function. Now, dementia does not mean that you can't remember things. Dementia can look lots of different ways. Other aspects of thinking can be affected within different types of dementias. People commonly think of Alzheimer's disease, where the predominant cognitive deficit is memory. But and memory can be a complaint that many older adults have, but these medications we know affect memory. So sedatives, that's your barbiturates, your benzodiazepines or benzos, Xanax, Valium, that sort of thing. Even antihistamines, antidepressant medications. Now, this is not that all of these different types of, every single type of sedative, every single type of antidepressant or antipsychotic is going to have this negative effect on memory. That is not the case, but there are select medications within each of these categories, some of which might be unexpected, that can affect memory. And so it's just worth asking your prescribing provider about, are there any sort of cognitive effects? Will this affect my memory? Is this anticholinergic? There are extensive lists. I have a long one right next to me at my desk because I have to reference it. There's an extensive list of medications within these categories and others. I just have a few, several listed that can negatively affect memory. So being aware of that, even some over-the-counter medications, like I said, the antihistamines, medications for Parkinson's, muscle relaxers, gastrointestinal antispasm and sort of bladder antispasm medications can affect memory function. Older adults are nearly 7 times more likely than younger persons to be hospitalized after an emergency visit, but most of these hospitalizations are due to just a few drugs that should be monitored carefully to prevent problems. And so this is from the CDC. And this is, again, just to be clear, this is not to say that one should not be taking these medications. If you have seizures, I want you to be taking your anti-seizure medication. But it's worth noting whether or not this medication, that you being on this medication requires you being monitored. So having blood drawn with some sort of regularity, or maybe talking about an alternative medication for that condition. All right, so what to do? Keep a list of your medications, follow the directions, ask questions. If you have a provider that makes it seem like you are inconveniencing them for asking them to explain something to you, then I encourage you to think about finding another provider, or at least seeking out a second opinion. It is our job to explain, to care for people. My job is to care for people, which requires me to inform them about what's happening with their brain health, so that they may feel compelled to take action, right? So it's not just do this thing because I have a white coat, but do this thing. Here's what happens if you don't do this thing. This is why I think that this is the thing that you should do. Here are other things that you can do for whatever the problem may be. So yeah, I sort of take alarm when I hear of patients who are working with providers who do not take the time to speak with them about what is happening to their own body. Take medications only as directed, keep up with any sort of testing recommended by your provider, and review medications with your primary care provider. You know, just going over, if you're just seeing them once a year, your sort of wellness visit or whatever it may be, just reviewing all of your medications. We have folks bring in all of them, the pill bottles, and we go through and just make sure everything's updated in our medical record. You may just create a list, but I encourage all older adults to be doing this. This is something that everyone can do, certainly, but certainly older adults. Emotional well-being. So it seems so simple, but what I always say to folks, to say to my patients is, certainly the medications that you're taking is going to affect your thinking, but also how you feel is going to affect how you think. We have all had moments of anxiety, depression, even if it wasn't sort of a clinical diagnosis, but how you feel is going to affect how you move through the world, your ability to navigate stressors, and there will always be stressors. It is important to be proactive about pursuing social activity, general sort of physical activity, to find purpose. I see so often that some of my patients, after they retire, it's kind of like, well, now what? You know, there's no other thing for them to really pursue and to occupy their time. And certainly, you don't need to go from working full-time to volunteering full-time or whatever it may be, some sort of like community group where you're sort of grinding the way you would with work. But it is important to have purpose for everyone, regardless of what stage you are in life, but especially in older adults, when we see that the social aspects of life can really drop off. You're not going to work, so there's no you don't have coworkers that you're speaking with regularly. You may be retired. Children are out of the home, certainly. If you have children, it's just very easy to be isolated. And especially now in this era of COVID, year 3, here we are, the gift that just keeps on giving, right? And it's disproportionately affecting Black folks in this country. It is important to feel like you have purpose, whatever that is. No judgment. If your purpose is creating some sort of, I don't even know, like some crafting or helping with grandchildren, or like I said, working within your sort of church community, women's groups, whatever it is, it's important to have purpose. Avoiding chronic stress to the extent possible, right? And so I say that to the extent possible because we know that Black folks in this country, especially, we are sort of constantly, not sort of, we are constantly under chronic stress. There is community trauma that we experience that we are continuing to experience today, right? So to the extent possible, avoiding chronic stress. That could be related to, so common causes of chronic stress in older adults: finances, relationships, work-related stress, and caregiving stress. So maybe you are a caregiver for your spouse, whomever. I don't think that folks understand the weight of caregiving, the burden that caregiving can be until they've experienced it, or if you're interacting with folks on the day-to-day. It is a full-time job. So to the extent possible, avoid or diminish it. Seek treatment if you have any signs of depression or chronic anxiety. Again, depression does not, so thinking about, especially with Black older adults, depression and anxiety can look any number of ways. It does not mean that you are in the corner crying and that you can't get out of bed at all. It may look that way, and that's fine too. But it can look like irritability. It can look like mood lability. Knowing that, especially the ways that these mood changes can manifest differently than what we may see in media, or what just sort of in the general ether, the way that we think about, like, this is what depression is. It's a cloud raining over you. Like, again, it's okay if that's the way that one experiences it, but just knowing that it doesn't always look that way. It doesn't always look like you are completely incapacitated and debilitated. And especially within, as I said before, Black older adults. So finding constructive ways to manage chronic stress, physical activity, and mindfulness can help reduce stress and provide additional health benefits. And mindfulness, so really, I think that sometimes people think of mindfulness as your mind is completely clear and you are just 100% at peace. And that's not really what it is. Mindfulness is just being present in that moment. And it's especially good for managing anxiety. Mindfulness means that I am paying attention to how my body feels as I'm speaking, right as I'm giving this presentation. I'm aware of the ways in which my breathing might be changing, what it feels like to have my legs touching the chair, the pain that I feel in my back, etc. So just being aware of what's happening in the moment. And then if your mind goes elsewhere, you start sort of drifting and thinking about, oh, what are we going to do about this thing? Or we're going to have this dinner, or this event is upcoming, or I should have done this, or I should have paid that bill. And you just notice that you have strayed in your thinking and gently bring yourself back. You don't sort of admonish yourself and say, why can't I be present? Why am I not doing this right? And so mindfulness, it may not appeal to everyone, but I just wanted to make it clear that it may not be what you think it is. It's just trying to be present in that moment and not being judgmental if your mind drifts, if you're not being present, giving yourself grace, essentially. So speaking about managing chronic stress, wellness, these are sort of general wellness behaviors for older adults. So physical activity is essential to healthy aging. Physical activity is essential to healthy aging. So we know that Alzheimer's disease is the most prevalent dementia. We often talk about plaques and tangles within Alzheimer's disease, but more and more research, and certainly a significant amount of research that's already been published, is looking at the interaction or the role of cardiovascular health within Alzheimer's disease and other dementias as well. But I just, again, mention that because it's the most prevalent one. One of the best ways to manage cardiovascular risk factors, remember, heart health is brain health. So to manage your high blood pressure, your high cholesterol, diabetes, sleep apnea maybe, is physical activity. So these are the recommendations for adults 65 and older, at least 150 minutes a week. So it could be 30 minutes a day, 5 days a week of moderate intensity activities such as brisk walking, or 75 minutes of vigorous intensity activity such as hiking, jogging, or running. If you do not like to run, then don't run. If you do not like to hike, then don't do that. There are many different types of activities. I hate running. I have never liked it. It is very effective, but I will never enjoy doing that. And so it's just never going to be the thing that I choose to do. If in my mind, the only way that I can be healthy is to go for a run, then I'm never going to be healthy. Even with my degrees and all that I know about the importance of these things, it's just not going to happen. So find the thing that you enjoy. It could be if you have joint pain, being in the pool. There are a whole range of activities, and certainly many activities that have accommodations for folks who may have some sort of mobility limitations. It could be related to aging. It could be related just to disability generally. And then at least 2 days a week of activities that strengthen muscles, activities to promote balance, such as standing on one foot about 3 times a week. That's just an example. But so there's this cardiovascular, we want to get your heart rate going, but also strength programs. And so there have been weight training programs with seniors where, you're not pumping iron with sort of large weights or anything of that nature, but just very low weights at a moderate sort of rate. All right. And then again, if chronic conditions affect your ability to meet these recommendations, be as physically active as your abilities and conditions allow. And again, there are also videos online. There are whole programs that are aimed at doing some sort of physical activity with older adults who may have some sort of chronic condition that affects their mobility. So general wellness behaviors, sleep. So studies have found that chronic sleep deprivation is linked to increased cardiovascular disease. Again, thinking about especially Black older adults and our susceptibility to cardiovascular disease. So chronic sleep deprivation has been linked to cardiovascular disease, increased levels of inflammatory blood markers, and decreased immune function. So you're not getting enough sleep. That makes you more susceptible. That lowers your immune system, makes you more susceptible to contracting whatever it may be. And as I mentioned before, COVID's still here, disproportionately affecting us. And so thinking about how these behaviors that we don't think much about, it's okay if I'm not sleeping regularly, it can have this sort of snowball effect. It's also important to note that aging does cause sleep to become lighter and more fragmented and may cause people to need a little less sleep than when they were younger. That is normal. You may not be sleeping as much as you did when in middle age, but chronic sleep difficulties or often waking up feeling tired is not normal in aging. It's not necessarily indicative of a dementia, but it's something that's worth paying attention to. Older adults who suffer from sleep problems can often be treated once they're properly evaluated. It may be, it happened many times before where I think that the real cause of the changes in my patients' thinking is that they are not wearing their CPAP or their BiPAP. So sleeping without medication, I have that noted there. Thinking about, that list of medications that I had, and it was not a comprehensive list at all, but a lot of medications for sleep have these anticholinergic effects. And so if you're having difficulty sleeping, talking with your primary care provider about it, and seeking out sort of non-medication intervention. It could be mindfulness, it could be body scanning. And these are things that you don't have to go to any sort of expensive workshop to learn how to do. These things can be Googled. I think it's important to try and note, why is it that one is having difficulty with sleep? So is it because you sort of have racing thoughts? Is it because of pain? Stress, sort of life stressors. Are you just not sure, but you snore very loudly and you know you have sleep apnea and you're not wearing your mask? And so maybe that's why you keep waking up in the evening. And so that's a very sort of easy fix, potentially. But all this to say that sleep is very important in older adults for your brain health. And it is important to know how to sleep without taking a medication. And not that medications aren't necessarily sometimes warranted, but it shouldn't be necessarily the first intervention. Nutrition. So the Mediterranean DASH intervention for neurodegenerative delay diet, or MIND diet. And then there's a whole DASH is the dietary approaches to stop hypertension. So this is a very incredibly long name, but the MIND diet, you can Google it. That is a highly recommended diet for older adults and thinking about preventing cognitive decline. Keeping in mind, also, you want to continue to manage chronic conditions. And so if you have diabetes, you may not necessarily be able to comply with this. But so the MIND diet lowers the risk of dementia and decline in brain health that people often experience as they age. These are highlight plant-based foods and limit the intake of animal and high saturated fat foods. They recommend these brain healthy foods to include, and then 5 unhealthy foods to limit. But outside of that, there are no sort of extensive guidelines. I said the MIND diet, but not thinking about it. This is something that can be sustained. This is not sort of a fad diet the way that we may think of it. Really changing your eating. And it doesn't have, for all of these things, it doesn't have to be all or nothing. It's not like if you're not running a marathon, then you might as well not do anything. It's not as though if you are, let me just go to the next so you can see some of the unhealthy foods. If you can't give up, or, you love cheese, then there's no point in trying. So incorporating 1 or 2 things slowly over time, gradual changes can have a real impact on longevity and your quality of life, regardless of whether or not one develops a dementia or not. It can have real effects on your overall health, quality of life. So a few more things, more sort of wellness behaviors. Avoiding delirium. So this is when folks have a significant change in their thinking. There's sort of like altered mental status. Oftentimes after there's been some sort of procedure, if they're in the hospital, it doesn't have to be any sort of major surgery or anything like that. Especially folks who have had delirium repeatedly, older adults who have had delirium repeatedly, that is associated with accelerated cognitive decline. All older adults generally are susceptible to delirium. We can see it just from the stress of being hospitalized or having a serious illness and being in an unfamiliar environment. It's not forever. It's different than dementia. It can look like dementia, but just the rapid onset and then usually some sort of resolution. That's what really helps distinguish it from a dementia. And so it's not permanent, but to the extent possible. So if you or a loved one is going to have some sort of procedure, talking about, well, what's the data look like with whatever medications may be used during that procedure and delirium, or that medication, the effects it has on older adults. I've seen folks who, after having these conversations with the provider used a different medication for the procedure, or the follow-up care might have been a little bit different. The immediate follow-up care after whatever the intervention was. So just asking about these things, just knowing that delirium is a thing, it increases one's risk for cognitive decline, and having that discussion. A few other things that I just sort of threw all together, but thinking about falls. So it's common, older adults have different sort of spinal stenosis or knee replacements and hip replacements. They may be more susceptible to falls. Being physically active will help strengthen folks, and so they'll be less susceptible to falls. Staying on top of vision checks, any sort of screeners that you may complete in your sort of annual visits in your primary care office, taking it seriously. And so if there was some sort of elevation on a depression screener, and the provider speaks with you about that, then not necessarily just sort of dismissing it, or being resistant, and thinking especially about substance use in older adults. So going back to everyone's body's functions differently as we get older. The way that we metabolize alcohol is very different. So whereas even in your sort of midlife, you were able to have 3 drinks and feel sort of minimal effects of the alcohol. In older age, it may only take 1 drink and you are, real loopy. And again, it's not because anyone's done anything wrong. It's just your body functions differently. It takes a lot less, and it can have a much more sort of deleterious effect on your functioning, on your thinking. And so taking those screenings seriously, cancer screenings, maintaining, being up to date with vaccinations. And I think that I was just looking to see if that's really it. I'm very happy to answer any questions that anyone has, and I appreciate everyone's time and attention. Let me go back to there we go. All
right. Okay. Thank you so much, Dr. Reed. That was a great talk. A lot of great information there, especially about brain health in Black communities, and really interesting that link to heart health as well. We did have one comment in the chat about how sometimes hypertensive medications may not always work well in certain individuals and in Black populations. And so I think you gave us some really great tips here of other ways to be working on your health, cardiovascular fitness as well.
Yeah, absolutely. I wasn't even fully aware of this until I guess sort of somewhat recently, but yeah, the anti-hypertensive medications, and this is not my specialty. Like I don't prescribe or anything like that, but just knowing that certain medications work better for us than others, and high blood pressure is rampant throughout the Black community. And so I didn't know that as someone who has been within sort of the medical field for years. But yeah, it's very real, and it's very real. And so I just want everyone to have the information moving forward.
Mm-hmm. And another question here. Do you have any guidance on how we can talk to aging parents, family members about brain health, or even potentially seeing signs of decline? How might you approach that?
Yeah, I think that it is important to sort of enter those discussions, letting your family member know that you are coming from a place of love and care. So it's sort of the difference of, why do you keep, forgetting things? You keep making these mistakes, or even making jokes about it, right? Like, oh, mom is always so whatever it may be, so forgetful, and she can't remember anything lately. Like, what's going on? You getting a dementia? Or just sort of these like jokes, that these sort of off the cuff comments, like avoiding those sorts of things, even if intent is not to be malicious, certainly. And saying, hey, we know that it would be helpful just to even get baseline testing. Like, if you are sure that you are seeing some sort of decline in a family member, and you know that they're going to be reticent to follow up with a provider about it, approaching it from a just like general health, I think this is like health and wellness perspective. And it's also true, I'm not saying that you should lie, but it's helpful to have baseline neuropsych testing, so that if something happens in future, then we're able to detect it sooner, which is the sort of the key to treating most medical conditions. Early detection is key. So approaching it like treat this as part of your general overall health, maybe getting like a neuropsych evaluation. I've seen folks who were like, I'm going to do the testing as well, like to encourage their parents to do it. They are not necessarily concerned for themselves, but especially if there's like a family history of some sort of brain disease, certainly dementia. And I think that maybe sharing some of the information, whatever you think might resonate with them. I would also approach it from a, like, this is an empowering, we have to advocate for ourselves. Mom, dad, you have high blood pressure, you have sleep apnea. We are dying. We, Black people, are dying, and cannot necessarily rely on systems to refer us to to see a neuropsychologist, neurologist, whatever it may be, to have sort of the next step done. And so I'm advocating for you and for us. But yeah.
Thank you so much. So that concludes our presentation for this evening. We have another great talk scheduled for you tomorrow night. This will feature Dr. Sakina Butt and brain health in kids. So same time, same place. We hope to see you back. All right. Have a good night, everyone.
Night, everyone.